My sister's a therapist and I tell jokes. We both want to help all kinds of folks.
Hello. Welcome to My Sister's a Therapist. My name is Virginia Jones. I'm a stand-up comedian, but I'm also a sister. And that sister is a therapist, and her name is Laura Ryan.
Hello, I'm Laura Ryan. I'm a licensed marriage and family therapist, but my main credit is sister to jovial jokester, Virginia Jones.
I don't like that one, but let's move on. On this podcast, we take turns researching a topic that we're interested in or something that's happening in the world and surprising the other person with it. This week, I am surprised with a whole person that Laura has brought.
Dr. Melissa Carrick is a second-generation chiropractor. She received her Doctor of Chiropractic from Parker College of Chiropractic in Dallas and received the James W. Parker Chiropractic Philosophy Award. Since graduating from Parker, she went on to become a certified health coach from the Institute for Integrative Nutrition. Prior to her chiropractic career, Dr. Carrick received her master's in theology from the Weston Jesuit School of Theology in Cambridge, Massachusetts, and her Bachelor of Arts in English from Holy Cross University in Worcester, Massachusetts. It was through studying theology that she realized the extent to which healthcare so often separates the body from spiritual and mental health. Dr. Carrick currently works in the Baltimore, Washington area at Carrick Health and Chiropractic and is the president of the One Research Foundation, whose mission is to advance mind-body healthcare through research, education, and service. Welcome, Dr. Melissa.
Thank you. Thank you. It's so good to be here.
You have a theology
degree. Yeah,
I know. Whole person care, baby. I was actually in divinity school and wound up changing programs about halfway through when I woke up and was realizing, one, my whole lens of looking at things was through the whole person, and the people I was working with were treating and caring for the human person and the human spirit, but they were neglecting the body. So I changed programs, got the master's of theology instead of divinity, and basically had to go back and become a scientist from literature and theology.
So you were planning on becoming a priest?
Clearly in the Catholic tradition.
It makes sense, right?
Yes.
And one thing that I also noticed is you and I both have an undergraduate in English.
I have an English minor. I just want to say.
Oh,
I have a minor in sociology, if anyone's checking.
Minor in religious studies, but all Eastern religions, even though it was a Jesuit institution.
Wow, that's cool. Today's topic is NET, which is Neuro-Emotional Technique. I have a certification in NET, and I think that Dr. Carrick does.
So that's what I hear, is that Dr. Carrick has some involvement.
She's a little bit involved in the organization.
Everything I know about NET, I learned from Laura and have talked to her during her trainings and a little bit about how she uses this thing, but I'm going to learn a lot about it today. In the mid-1980s, Dr. Scott Walker started developing a procedure which he eventually named NET that would help his chiropractic patients who had chronically recurring verbal subluxations, those cases where a traditional adjustment didn't always hold and the patient's symptoms failed to fully resolve. This is not the same Scott Walker who was in the Walker Brothers. He's a different guy. He did not also have a huge musical career, different person. What he came to discover was that there was often an associated emotional stress overlay that was re-triggering the physical problem. And once this was addressed, patients got better in body and mind. He was a chiropractor treating the body, treating the spine, but he found that people were failing to get better because of emotional problems.
How did you find yourself in with Dr. Walker, a strange Christmas elf who always wears a beret? Besides being a snappy dresser, what was it that got you interested in Dr. Walker?
We just talked about my change in degree and going back to chiropractic school. My parents had called me when I was in divinity school and said, hey, you really got to come to the seminar. It really cares for the whole person. You got to see it. And I said, no, I'm in divinity school. No, I don't want to go to chiropractic school. And I wound up going to the seminar. When I was there, there was a doctor on stage who was doing something that was very much like NET. I was like, wow, I want to do that. He seemed to really slice into the heart of the matter. And that's one of the things I call NET precision mind body, because it really slices into what's going on with the person without much guesswork. So seeing that, I was like, okay, I'm going to do this. I'm going to go to chiropractic school. And it wasn't until my second trimester, my first year, somebody grabbed me at lunch, said, Dr. Walker's here. You got to come see him. I found myself in this amphitheater and all these people around. And apparently it was the first time Dr. Scott Walker had been on a chiropractic school campus teaching. He's lecturing and then he does a demo, and I volunteered to be the demo. Not knowing at all what I was getting into, I suddenly found myself bawling in front of all these people as a first year student. It was the thing that I had seen years before on stage that got me to chiropractic school.
Oh, that's cool.
And yeah, it was a full circle moment. They didn't offer that at chiropractic school until my final trimester. They had it as an elective. So I took a few classes, but my first NET seminar was actually when I was starting my own practice. I practiced with my dad for a little bit and then opened my own practice. The weekend before, I went to my first NET seminar. That's where everyone was so welcoming, so awesome, so great.
It's a great crew of people. When your dad's a chiropractor, does that mean you have to become one?
That's such a great question because there's so many multiple generations of people. There's 16 of us in the family.
It's like shoemakers or something.
Yes, it is. It is. Hopefully, I mean, the same thing doesn't apply to shoemakers, that they have no shoes. We have no spines. We've got no alignment. We've got no posture. It's common because there's an inherent philosophy that's within chiropractic. In some ways, it's a very countercultural way to live, especially if you grew up with it in the 80s.
I would imagine that you were raised in a certain way with a certain mindset.
Yes.
It makes sense that you would want to be around people who are doing that.
I worked overseas for a couple of years. I was nearly a priest.
You were this close.
I was this close.
They were about
Not
to
the
put the
nunnery.
dog collar on her. No, I want to crack backs.
Yeah, exactly. And it was not the nunnery. I'll just have you know.
Get thee to a nunnery.
This is interesting because I've walked through the classrooms and seminars that Laura has trained in, just hanging out, waiting for her to be ready to go to dinner. I did notice there were a lot of chiropractors there, and I didn't understand why. This is a therapy thing. This is something therapists do, but it actually comes from this other science.
I was really shocked at how many chiropractors were there. I didn't realize it was such a chiro heavy situation. It's the first training I've ever attended that wasn't just therapists. It's the first training that I've ever been a minority. And I like being the majority.
Which is starting to become more and more. And I love it,
Yeah.
seeing more and more therapists in an NET seminar. I teach those seminars, and it's so awesome to see that and learn more about the culture that exists within the therapy world, and to see people. We've got Bessel van der Kolk's work of The Body Keeps the Score. We've got havening and all sorts of techniques where people are waking up to the integration of the mind body. And obviously I have a bias, but NET is really a place where even the structure of chiropractors and therapists integrate that mind body. Fun to watch.
Amazing.
So my role on this podcast is frequently the dummy who does not know very much about therapy. NET and therapy seems like such a peanut butter and jelly combination. My question is, what is the difference between the tools in EMDR and NET?
I got my EMDR certification first, and I found that when I was doing EMDR, we're asking the mind a lot of questions, and a lot of my clients couldn't get into it. They were confused by the questions. I'm asking them to do all this heavy lifting, come up with these scenarios, and a lot of people just couldn't get into it, or they were so traumatized that it felt really overwhelming. I had done NET as the patient. I think I could help a lot of people with this.
Oh my gosh. This is like one of my favorite things. And I love that you asked this question, especially because it really comes down to the physiology. And I don't know how much you want to nerd out about the brain. I dumb it down. That's actually my role, is to make it simple.
Thank you.
I love this question because I get asked so many times, as do many NET practitioners, because EMDR, I think they have really great press.
They have an incredible PR team.
It's awesome. I wish we had that PR team. That's something that I would like to make happen. So even on podcasts like this, continuing to spread the word. I want to be clear, not knocking EMDR at all. The distinction that I see, and I've made a study of this because I get asked the question so frequently, oh, this is like EMDR. Oh, I've done that. It's really about the physiology. EMDR takes people directly into their trauma, and you go into the trauma, and sometimes the nervous system, not the mind, not the body, but the nervous system itself is so traumatized that it can't go there. And you're expecting rational answers, like you said, from a brain where the trauma is not lodged in the rational brain. The trauma is lodged in a whole different part of the brain. So in the amygdala and the parahippocampus, right? The amygdala is our alarm center of the brain. That's like, alert, alert. And its function in our physiology is to keep us safe. And it's paired with the parahippocampus, which we have in a lot of our research. The parahippocampus's job is to tell us in our body, where were you? What were you doing? What did it feel like NET really works with that to bring that trauma up in a safe, closed space container. Talk about Buddhist principles. It's controlled suffering. It's in this arena where you're right in the space and trusting that the physiology will only take you to the place where you feel safe to go. Let's say you had a trauma when you were 8 that was pretty horrendous, but you had something similar or related based on a generalization of a stimulus, which we can talk about more if you like. Then you had something when you were 21, and then you had something when you were 29.
They just compound.
Yes. And basically, it's neuroplasticized into the system. So that's the fancy way of saying it's made into the same network where that alarm part of the brain, the amygdala, anything that feels similar is going to go, alert, that feels similar. And it's not on a conscious level. So in NET realm, the classic example would be kids are born with 2 main fears: fear of falling, fear of loud noises. A child is petting a white fluffy cat.
I know this study, and I'll tell my dumb person version of it.
Yeah.
There's a white fluffy cat, and then while the child is petting it, a loud noise happens. It gets a fear response. Eventually, the child would cry at the appearance of a white fluffy anything.
Right? Yes, which includes a dog. Even if they've known that dog forever, then all of a sudden it freaks them out. And then Santa Claus, and that stimulus generalization that is based off of Pavlovian conditioning, ring the bell, bring the food, ring the bell, bring the food, and then the dogs are drooling. That stimulus generalization, we don't always know how far that extends. Why somebody walking down the street makes us get all nervous or suck in our breath. It's the physiology that's responding. So NET, to make that distinction with EMDR takes you directly into the trauma and almost in some ways forces the physiology into that rather than allowing the physiology to go to the place where it can look at that trauma in a safe enough way or re-experience that trauma in a safe enough way. And it may come up in another session because the physiology is at a stable or safe enough place where it can do that. The other distinction I would say is that, to my understanding, because EMDR pushes on that trauma and takes you directly into it, sometimes you need another tool like journaling or meditation or breath work to work with that trauma. And within NET, it's a closed system where there's no need to develop another strategy or tool.
When I was an NET patient, every week I would go back and it was 21 years old. And I'm like, why am I 21? Who cares about what happened when I was 21? I want to go to 3 because that's where the real juice is. My therapist let me know that no, your body's not ready to do that. So you're going to stay at 21 till your body's good and ready to go to 3. The way that I explain it to my clients is all of these things are on the same neural network. They all live in the same place. When one thing gets activated, they're all activated. And this is what I experience a lot as an EMDR clinician. I will say, okay, so let's go to that day when you were 2 years old and the mobsters came in your house and people just shut down. This isn't how it's supposed to work. You're supposed to do this because that's what
you're supposed to be ready to deal with it. There's like a gobstopper. So there's layers of trauma.
Yes.
And they get spicier as you get towards the middle.
Right. Yes. Exactly. And so I'm asking as an EMDR clinician, we're going right to the center of that gobstopper. Go for it. And a lot of people just won't. I remember this one client, we got nowhere for a year because every time we would start talking about the horrific things from her childhood, she would dissociate. She would check out because it was too much. She was getting overloaded. We're going to reference my handout that I give to my clients.
Ooh.
What is the neuroemotional technique? NET is a scientifically supported therapeutic technique that is designed to uncover and release emotional stressors that are stored in the body. These unresolved emotions can manifest as symptoms like stress, compulsive behaviors, phobia, anxiety, and mental blocks that can ultimately prevent people from having their best relationships and enjoying their lives. NET is built on understanding that the mind and the body are deeply interconnected. Emotional traumas or stressors can become trapped in the body, leading to issues that can affect health and well-being.
So good.
Thank you so much for casting so far a net in order to bring research into the podcast, your own handout. Thank you.
Actually, speaking of having crappy PR, I couldn't really find a lot on NET on the internet. It's net, mind, body. I want to find things outside of the organization. There's really not much. I had to rely on my own handout.
Thank you.
Thank you for spreading the good word, one patient at a time.
Exactly. Of course, I have a bias. There is all the One Foundation work. We are working right now. It's been a commitment of mine to make sure that we get a social media presence so that we actually get in the century. We do have the documentary, the docu-series that we produced, as well as all the different brochures based on the research and the research studies.
NET can help you identify emotional blocks, update mental models, and gently release past programming, allowing your mind and body to be restored to balance and harmony.
I was just listening to a story about a man who had been drugged and essayed by his female date. She's really striking out into new territory. He went to the gym and a woman of similar builds came in and he couldn't be there anymore. It's interesting how the brain is always scanning for these danger signs and finding them in other situations and other people. I've been here before. I want to get out.
A lot of times we can't pinpoint. We just get the feeling.
I'm just having an anxiety attack for no reason.
Yeah, something triggered it. And we use that word of trigger or activated. That's what is happening, is that part of the brain that is used to keep us safe. And what is cool, neuroscience is changing so rapidly all the time. The amygdala is used to keep us safe. Basically, it repels us from situations that are dangerous. That's the survival mechanism. What we have been finding in neuroscience is that the amygdala also pulls us towards joy, which is fascinating. If it's pushing you away from something that's dangerous, it can't be engaged in that pulling you towards joy. If we want to feel more joy in our life, if we want to feel more love, we've got to deactivate and resolve.
This quote is, it was once believed that emotions were solely a function of the brain, but research now reveals that emotions are intricately tied to our entire physiology. The whole body keeps the score thing. These connections are made on a molecular basis utilizing neuropeptides, hormones, and other specialized molecules that permeate the body and can even influence our DNA.
We are built to survive. I think the mistake that we have made in science is that we have separated the body and the brain. It's all connected and it's all one.
The brain is in the body. The body is not just a shell carrying the brain around. It's all wired together.
And we've gotten a lot of that from the Cartesian split. Cogito ergo sum. I think, therefore I am. It's this separation of brain and body then started to permeate our culture. And you have the advent of science and, well, let's prove everything. And Descartes, I can't remember who he made this deal with, but he was allowed to work with bodies as long as he didn't deal with the spiritual realm. That separation was built in. And then the advent of science, and this is not religion, we're going to factually find it. We're going to identify the place and particle, which is fascinating if we're looking at current neuroscience, because we've moved from parts of the brain are in isolated locations to, it is more about, as you said, Laura, the network. The amygdala is really talking about the network of neurons. You mentioned all of these particles, and that's, thank you very much, Candace Pert. So Candace Pert wrote a book called Molecules of Emotion, and she basically staked her entire career. She was a Hopkins physician, I believe, molecular biologist. There are these molecules, emotions are these things that move and they're in motion, which we now know and accept. But then she was ridiculed out of the scientific community. I was on a call last night. We were talking about emotions are feelings in motion. And you have the cerebellum coordinates that function. This is what we're doing in NET. And some of the research that we've done with the One Foundation, the cerebellum coordinates our emotional processing. It coordinates our emotional function, which is why if you go for a walk, you're going to feel better. Or if you do yoga, you're going to feel better.
Because it's all connected.
EMDR, you're giving physical tools to calm your nervous system.
We have a thing called tappers that you use. It's basically to help you clear and process the trauma. If I'm holding these tappers and following it with my eyes, it helps to get my brain in such a place where I can process through the material.
To your point that there's not a lot of public knowledge about NET, I would like to ask you both about the physicality of NET and how that connects you to traumatic thoughts and memories.
So how does NET work? When we experience trauma, we create complex mental models designed to keep us safe. These mental models or schemas create trauma symptoms that people struggle with, such as attachment issues, nervous system dysregulation, and other unhelpful coping strategies. There are instances in which an emotionally conditioned response does not fully extinguish after a traumatic or emotionally challenging event. NET can be utilized to help the body complete this process and grow past the mental models where we historically become stuck.
Instead of having a physical tapping that helps center you and put you back into place in EMDR, NET is using touching your forehead, touching your hand to connect you to things held in the body.
The idea is first that trauma. This has been studied with big trauma like post-traumatic stress syndrome, pelvic pain, and veterans. So there's all sorts of big trauma, but it's also for everyday stressors, things that you can kind of feel your heart quicken with or gives you a headache. It's utilizing the principles of Chinese medicine. We have these meridian systems throughout our whole body, and this is thousands of years old. It's being studied more and more. And we know that from Chinese medicine that every organ is essentially a house of different emotions. So we have where that pathway goes, but we also have the organ, and the organ is not the physical location. It's the organ itself as well as the pathways through the body. For example, fear. Kidneys are fear, paralyzed will, dread, impending doom, all the things that have to do with being scared. Interestingly enough, the location of the kidneys is just above the low back. There are some techniques that say low back pain is definitely about fear. Not so in NET. We get much more precise with what's going on. And fear can relate to any condition, headache as well, as we know where the meridians of that bladder and kidney go. The idea would be that you're holding either the Chinese medicine pulse points, the acupuncture pulse points that are along the wrist, and then you're holding the neurolymphatic points, which are points along the forehead that are our stress points. When I'm with a patient, I often will say, hey, we actually are hardwired with these points in our body. When you think about something bad happens and you slap your forehead and go, oh no, or you're trying to figure something out and you're rubbing your forehead.
Right.
Yeah. My husband calls it holding my brain in when I'm just like this, kind of going, okay, let me figure this out. We're hardwired naturally with those points. It even feels good when we touch them. So we're hooking up either the pulse points on the wrist, which is what Laura and therapists do, and hand on the forehead, or as a chiropractor, I may do that, or I may use the spinal segments that relate to that particular organ and the sequencing that relates to that particular organ. And it's a light tap on the spine. So it's not a classic, what people think of with chiropractic of snap, crackle, pop. It's instead a light little tap in with an instrument or with the hand.
A long time ago, I was in China and I was looking at a poster of the reflexology points of the foot.
Yeah.
At the bottom of the foot, where the sole meets the heel almost.
Yes.
There was a little dot that said vomit point. And I just think we don't talk enough about how important it is not to touch that.
Do not touch that. They do that in the training. Laura, do not touch that. If we didn't cover it, do not touch the vomit point.
I haven't touched a lot of feet while doing anything. Actually, with confidence, I haven't touched a single foot with doing anything or anything
Not
else in my
foot
office.
one.
I'm a chiropractor and I adjust wrists and ankles and necks and backs and feet. I have this patient currently. We did NET on the foot pain to see what's actually living in that foot, what's being stimulated, and the body is, we could say, manifesting. The pain pattern, the pathophysiology is manifesting in the foot. We did NET and it was 80% better.
Wow.
This person's walking like normal. Wow is the appropriate response. That's the response I get too. Like, wow.
I've been slow dripping NET into my office and I have 3 separate clients. They don't know each other. They're all strangers to each other, but all of them have said, are we going to do witchcraft this week?
Oh, yeah. Yeah.
It is witchy.
It's
I'm
giving witchy
going
vibes.
to touch you here. I'm going to say this thing. We're going to burn this thing.
We burn a lot
You
of
burn a
items.
lot. Burn it a lot.
Did you
Burn
bring
it
the
a lot.
rabbit or didn't you?
Yes, I
Take
always
a
bring
bit.
small bones into the office for those appointments. It's very important.
This is a very Portland moment. I was on a walk yesterday with some girls and we have the little free libraries. This was a little free ossuary. It was for dog bones. Take a bone, leave a bone. There's nothing more
That-
Portland than that.
So you were asking what are the physical tools? The other important thing is the breath, because we know that breath unites mind and body, and the breath is that part of the physiology. When I say closed mechanism, Dr. Walker often says that the patient comes with the problem or the issue as well as the solution with them internally. The breath is part of that. And we know through all different healing traditions, through all different cultures, that the breath is part of it. And that breath is also part of what is reflective of sympathetic and parasympathetic nervous system, your fight or flight, or your rest and restore, or rest and digest. So the breath is part of that. You hold the points and then you either tap on the spine or you hold the points and you hold the points on your wrist and breathe while you're focusing on the picture of the trauma. And only you know the exact picture that's going to stimulate all of those neuropeptides, neurochemicals, hormonal responses, inflammatory cascade.
And I have to, on the daily, remind people to breathe.
Breathing is something that we've all accepted. This is a way to recenter. I can observe that my breath gets shallow and fast when I'm stressed out. I know that taking a deep cleansing breath is going to help me. We do it in meditation and we do it in yoga. That's a little baby step to the mind-body connection is breath.
Yes.
We talk about a book, The Body Keeps the Score. What does it actually mean? Molecules like neuropeptides and hormones circulate through the body, carrying emotional information from the past. These substances can influence our physiology, including our DNA, and are central to how our emotions and trauma history can affect the entire body. NET uses a technique called muscle testing to pinpoint specific emotions that are linked to physical or emotional symptoms. This process helps to identify the point that an emotional stressor became trapped in the body. So this is witchy. When Laura showed this to me, it felt like party hypnosis.
That's so interesting. I would say witchy science.
We're doing
science.
Let's demystify it. We can get real complicated, but we're going to keep it simple. The body's an electrical system, and there are 3 different types of muscle testing. So let's make that distinction right now. The type of muscle testing that is an orthopedic muscle test. So if anyone's ever been to an orthopedic doctor or a more traditional chiropractor, it's testing a nerve muscle response, a nerve root. So C5 is the deltoid. We can test C5 deltoid. Okay, you can test the quads. Are they firing? And it's graded on a scale of 1 to 5. Some people might say 0 to 5, but really it's 1 to 5. And how strong is the strength? And you're looking at the actual physiological function of nerve muscle connection. Then there's a neurological type muscle test. And that neurological type muscle test is what we use in NET. And that is measuring the body's response or neutrality or dissonance to a certain stimulus. With Pavlov, the stimulus response, we have a physiological response like salivation to food being brought. And that's normal and natural. So we all have stimuli that we respond to. Utilizing the arm or any muscle in the body, frankly, even the big toe, if we want to go to the feet, it's noticing the body can respond to physical touch. We could almost say a weakening agent, or it changes the neurological functioning momentarily of that, or it can respond to a sound like the bell in Pavlov. We now have found that it can respond to semantic responses to words, and the body can also respond to feelings. And we all have that sinking feeling. We know when our body just starts to slump over. It is very similar to what is used in a polygraph, a lie detector test. And in that test, we measure galvanic skin response. So basically, how's the skin responding? We measure heartbeat. Now we look at things like HRV, but we measure skin temperature. That's actually what the muscle test is working with.
What is HRV?
HRV is heart rate variation.
Yeah.
Dr. Missy and I both have a special ring that tells us what it is, and it's a good tracker for your stress.
Yes, which is amazing because with this, people will be like, oh my gosh, doc, I can't even believe it. My Aura ring told me I got so much more restorative time after I was in your office, or my sleep improved this much. Or did you know, since I've been seeing you, I've contacted Aura. I'd love to do some research. We have this foundation where we can track this because I've seen it over and over again with my own patients. There's other devices that track all sorts of things. And I noticed a difference with NET, which is pretty remarkable.
It's awesome.
Once the emotional trigger is identified, we utilize a process that's designed to help you release an outdated emotional reaction and break down dysfunctional mental models. After the NET process is complete, you will likely experience a sense of relief, clarity, and renewed energy. This process allows your body to return to its natural state of balance, promoting overall healing and well-being. When Dr. Carrick was talking about the verbal reactivity, I was thinking about a phrase that would work for you or I because we grew up in the same household. If I said, I'm going to give you something to cry about, does that create
real quick reaction, real speedy?
So that would be a perfect thing. You feel the reaction real quick.
Yeah, you're real shocked.
Faster than the cognitive brain. That's a perfect time to use NET. And the muscle test would be, we could say, reactive to that. We have the science to prove this, by the way, of studies on muscle testing, including muscle testing is no better than a coin toss to prove fetal sex. So that third type of muscle testing, just to come back, we had 1 is orthopedic, 2 is neurological stimulus response, 3 is the yes-no questions. And that's not scientifically validated at all. So yes, no questions is like the person in the health food store that you see that doesn't make me, oh, should I get pregnant today? Yes or no? That's not a thing, at least in the realm of science.
In the world of witchcraft, it is very much a thing, but we're not talking about I saw that there was 27% accuracy rate when you're asking the body about the sex of the child that you have inside your body.
Your body is doing worse than 50-50.
Yes. Yeah, actually, it is worse than a coin toss.
Our mother is remarkable in this because she had 5 children. And what I understand is that she guessed the sex of every one of us and she was wrong 100%
of the time.
She was never right, which is why my name was supposed to be Adam.
Wow.
This is from the podcast, And How Did That Make You Feel? With guest Dr. Kim Makoi. Dr. Walker integrated some different methods coming from Chinese medicine and some different chiropractic approaches. Again, this is Dr. Scott Walker, not Scott Walker, who's saying Jackie. And then over the years, formulated this approach that combined a type of chiropractic adjustment with different acupuncture meridian theories. And I think the secret sauce part was when he realized it made a big difference if the patient was visualizing the trauma or the stress while the adjustment was happening. Laura, this speaks to something we just recorded, the Milgram experiment that had to do with telling people that their actions were delivering electric shock. When it was redone in 2006, they ran it through a computer program where you were just texting, I'm going to increase the shock to 145 volts. I'm going to increase the shock to 250 volts. And people didn't care at all. They were shocking an imaginary person all day long. But when they saw a visualization that they knew was a computer model, their body reacted as if they were electrocuting a real person. If you're just talking about the thing, that's not real. If you are visualizing the thing, that makes it real to us.
This is the next thing that Dr. Kim Makoi said in this interview. That's a super important part of NET. And I always think of it as resetting your computer, like the Control-Alt-Delete. You have to push all 3 buttons at once to get it to work, because if you do it separately, it doesn't make any difference. I'm sure that people who have been through these traumas have thought about the trauma before, but it's the act of picturing it while the adjustment is happening, while they're breathing deeply, that creates the reset in the brain. I think there's a lot of different techniques that have a similar kind of approach. And I think with NET, the thing that's special for me is that it gets you there very quickly using the muscle test and the 15 steps.
That's that precision mind body. The muscle test allows you to zero in on exactly what it is. And the whole point of visualization, as Dr. Kim Makoi, who I really love and respect, he's wonderful.
Shout out to Dr. Kim.
Exactly. Dr. Kim Makoi hit it right on the head. Visualizing it is specific to you. You know, your dad saying that, or just that phrase, you know the tone of voice, you know the expression, you can see it all in an instant because it lives in your tissues. In NET, we often say the issues are in the tissues. It instantly activates all of those neuropeptides. The whole cascade starts to fire off. You see the flushed cheeks, sometimes the tearing, whatever it is. And visualizing it brings up that physiology as is unique for you. So it really is the special sauce of that controlled suffering.
When you're visualizing something and when you are, as Missy said, in it, your brain can't distinguish the memory from the now. The issues are in the tissues, and the tissues have been misused.
The tissues are full of snot. I love the idea of Control-Alt-Delete. I have to press all of them at the same time in order for it to work. Just pushing one button at a time is not going to make it all work. It all has to go at the same time for it to have the desired effect.
Yes. And it's so interesting with the Control-Alt-Delete. That's such a brilliant way of putting it. There's also something really powerful about having a very skilled therapeutic partner in that. FAST technique, there's a technique that is like home care for NET, and it's measurably helpful and you can do it yourself. I think there's a powerful piece of having that other person there to do the muscle test to actually facilitate it, but also in that presence of another person. I think that we are in a DIY culture. Oh, okay, cool. Well, I'm going to visualize that, what I think is my trauma, when really the part that is hooked into that amygdala may be something different than what your cognitive brain identifies as your story. Oh, it's always your mother. It's your mother. It's your mother. Right. And it's actually not your mother. It's a different facet than you think.
Yeah, having the input from another person.
Because you're working with the neocortex and the amygdala, so it allows them to come along.
So the question here is it always something that would be considered traditionally traumatic? And Dr. Makoi said, in NET, we work with what's called the emotional reality. So the emotional reality doesn't always match historical reality, and it kind of doesn't matter. We talked about this. Your truth may not be
historically accurate.
Yeah, your brain tricks you. For example, you're driving down the road and you're a big animal lover and you see a dog that was hit by a car. You get all upset. But as you get closer, you see it's just a trash bag. It wasn't a dog, but you had an emotional experience as if it was. So your body can be traumatized by something that maybe never even happened, but that's what you perceived happened. I cry at trash bags all the time. This made me laugh when I started reading it. I tell myself that story all the time. And I'm still sad that it's a trash bag out there alone.
Maybe there's an animal in the trash bag. You never thought about that, I bet.
Maybe the animal used to have that trash bag and has lost it and doesn't have anywhere to keep his stuff.
Why do animals need trash? back to Dr. Kim, sometimes something will come up with NET, some traumatic event or abuse or something. And then people will think, oh my God, did that really happen to me? And we don't know what historically happened, right? But if your body experienced it like that, then it doesn't matter because your body is acting off of that information. So that is your emotional reality. And this is something that I think is really cool about NET. It doesn't matter if we get the facts right. In the Mandela Effect episode, we talk about how when I do hypnosis, I've had people come to me and say, I want to remember something. And no, I'm not going to touch that because I can impact your memory and we don't know if it's actually real. When it comes to NET, it doesn't matter if it was real. If something happened in your body and we're going to clean it out regardless of if it was a trash bag or a real dog.
Because it's affecting you. We're not going to the police. We're not going to write a book about it. We're trying to clear out something that is affecting you in your day-to-day life.
I have a cousin who's a priest, and he used to say, all stories are true, but some really happen. The whole point is that the physiology is firing off and our perception. This is one of my favorite ways of looking at this. It's the nature of how memory works, which sounds like you guys already talked about. Our memories do evolve over time, or as Dr. Dan Monti says, right, the brain doesn't like Swiss cheese, so we fill in the details, but we also have these pairings that happen. They took a group of people right after the Space Shuttle Challenger blew up and said, where were you? What were you doing? And they told their stories and wrote it all down. And then 10 years later on the anniversary, they asked the same exact people. Mm-hmm. And the people said, radically different stories. And it's not that every single one of them were liars. It's just the nature of memory is our emotional reality.
Every time you tell a story, it changes and that version becomes what's lodged in your brain because you're telling it and your brain's like, oh, this is what happened.
Yes, exactly.
So when I tell you that I met Santa Claus and the fur on his coat made me cry because of a cat and there was a noise, I think that that happened because I told it to you.
And then Santa said, I'll give you something to cry
about. I want to be compassionate about this, but we get attached to the traumas and the stories that we tell. At a live NET seminar, a guy got up, he was the demo. As the story goes, it went back to when he was 3, 4, 5 years old, and his father started beating him. From that point on, he and his dad had this terrible relationship. And the brother was in the audience, and the brother went, hey, wait a second. I was actually there when this happened. What actually happened is that you fell into the fire. You were playing and your clothes caught on fire. And so dad was smacking all the flames off of you because he was worried to death that you were keep bursting into flame because you'd fallen in the fire. This guy has lived his entire life thinking that his father was doing this. And then it changed the whole dynamic. And I always wonder, how often do we have that?
And I find a lot of times when I'm the patient, I will have a very rigid memory. But as I reprocess, I realize, oh, wait a minute, maybe that wasn't actually true.
Yes.
When I get stuck in my 3-year-old or 4-year-old brain, it doesn't understand what grown-up me knows.
Exactly. And it's not that we're saying that everyone's traumas are made up or that they're not real. I want to be very clear about that.
No such thing as trauma.
Fake news, fake trauma all around. Trauma.
It's really validating, though, to know like, oh, well, all stories are true. Something really happened. And you use the word, Laura, I love this, changing your responses. So you said how you react. If we have that trauma embedded, whether it's historically real, our perception of it, of that trauma is embedded, we don't have the choice to respond because we're constantly unconsciously reacting to what our body perceived to keep us safe in the moment.
We get trapped.
Laura, I'll tell you that if you were on stage talking about how your dad was beating you on a camping trip for no reason, and I knew it was because you were on fire, I would tell you backstage. I would tell you after the show.
You wouldn't call me out in front of a group of people.
I wouldn't do that to you.
Yeah.
So what you're saying is that guy had a lousy brother.
Yeah. I can fact check. Did he wait till after? I'm pretty sure he stood up.
That's rough. Context is everything. Somebody hitting me because I'm on fire is way different than somebody just hitting me for the halibut, you know?
Yeah.
I've sometimes set people on fire so I could hit them.
Win-win. Win-win.
Or I hit them until they caught on fire.
That's
also win-win.
Okay. So Virginia, speaking of Dr. Monti, you have a quote from him from Stressed, a documentary film.
Dr. Monti says the passage of time wasn't making it go away. That's kind of an old conception that we found is incorrect. Time doesn't really heal all wounds because emotional wounds are in the part of the brain where there is no sense of time. To Laura's point, time changes the wounds, moves them around different places, makes you respond to them in different ways. Time can deepen the wounds as you retell this story and it becomes spikier and more difficult. When people tell you that time heals all wounds, what they're telling you is, I don't think you should try to heal yourself from your trauma. And if you are still feeling bad about the thing that happened with your 3, well, it's your fault.
That's a your problem, not my problem. That's a YP, not an MP.
Why do you keep feeding me on this camping trip?
It reminds me of what we talked about in the grief episode. Somebody used this analogy that I think was really good about grief. The idea is that I have a bottle, and inside that bottle is a huge ball. And over time, the bottle expands and the ball shrinks. I'm still hitting my grief trauma, but it's a lot less often as time goes on. That doesn't mean that it's not as poignant. Our father died around 12 years ago. Even though I don't think about him all the time, when I do think about him, it is just as salient. I'm not feeling it less. It feels the same amount. It's just less often.
Right. I'm not doing it 24 hours a day.
When he first died, it was all the time, but now it's every once in a while, but it still kicks you right in the nuts.
I still have an image on my phone of the day my father died. Laura and I started telling his life story in emojis back and forth. And it was baby emoji, boy emoji, man emoji, married my mother, church emoji, and then had children. And then my father did die of congestive heart failure because of his diet choices. So we just put burger pizza.
And then we put the gravestone.
Yeah.
Burger pizza, gravestone.
The meanest, funniest thing we've maybe ever done together.
Oh my God. So good. I have a sister who I am very close with, and this is just making me. Oh,
You can't wait to write burger pizza.
Oh, God.
Another quote from Stressed, a documentary from the One Research Foundation. There was a study done by Dr. Monti on cancer patients. Anna Tobia, PhD, said, one of the things that I heard over and over again from participants in the study was that these distressing memories and experiences would intrude or impact on positive experiences in the present day when they least expected it. So they might be chopping lettuce in their kitchen with feelings and stress and retching in their kitchen when they were ill from the chemo. So just being in the kitchen again, the passage of time, you go away, that's the conception that doesn't really heal the emotional part of the brain. The brain doesn't wear a watch. So even if I had this traumatic experience a million years ago, maybe the texture of the lettuce is going to bring that up. Maybe the sound of the chopping is going to remind me of that day that I threw up in the kitchen.
And I have known chemo patients who have ruined foods for themselves by eating them while they were sick. It's just too associative.
Yeah.
Yes.
This is a quote from Dr. Alan Knecht, who I've just been informed is a Portland resident, and maybe one day we will meet and rejoice. Sometimes things happen early in life where we are in a dangerous situation or something is perceived to be awful, and the body is unable to extinguish that response. Years later, we find out that the buried distress, those buried feelings that have never gone away, are still being triggered in any situation that looks the same, sounds the same, smells the same, feels the same. 100%. I think we all have experiences like this. Can trigger that on an unconscious level and can bring the feelings back, even though it's a different situation.
It goes back to that body keeps the score. Anything that we've experienced gets trapped in the body. I was with my sister, Virginia, not too long ago, and I walked in this bathroom and I smelled quite fragrant aroma, and it smelled exactly like this kit that we had when we were kids.
She ran and came and got me, and she said, come smell this bathroom, which is not something that people tell you all the time. Come smell this bathroom and tell me what you think. And I walked in and I was like, oh, this is the Barbie perfume kit.
It transported us both back in time. That's why smells are so tricky, because they get locked in. There's other things like sounds or feelings that sometimes you can muddle down, but smells really keep.
That's our most primitive sense.
The sense most directly tied to memory is Marcel Proust like to say, rechercher le temps perdu. But it's interesting because I have had this kind of experience with friends who have a traumatic experience with a smell, a location. They just make a rule. I don't walk into the kitchen holding a fork anymore. I can't go to Los Angeles. I can't go to a place that's heavy Mediterranean. Instead of healing the trauma that they have, they're just going to avoid the stimulus as much as they can.
I get it. In some ways, you're trying to keep yourself safe and using the cognitive brain to do that. But how much lack of freedom are you having? And the other piece of that is you can't escape the stimulus because of stimulus generalization. You might not go anywhere that's heavily Mediterranean, but then let's say you happen to be in Russia and you see olives painted somewhere and your whole system freaks out.
Well, that's it.
Yeah.
I guess I can't go to Russia anymore.
Yes.
Things are unexpected.
You become agoraphobic because you're trying to cut out all the stimulus.
Yes. It's also how much do we then become relationship phobic? where we can't relate to anyone and we start to become more and more insular, which I feel like God knows that's the least of what we need right now is to continue being more and more insular.
You think, oh, this is going to keep me safe in our political climate. I want to be safe from other people. I want to be protected from people with different political views than I have.
Yes.
But it's so bad for your mental health to cut yourself off from other people.
Exactly. All the way around.
Speaking of, hearing Donald Trump's voice is very triggering for me now.
The American flag has become a trigger for me. Now, when I see somebody with it, holding it, or see it on their truck, it's a fear response, even though they might be on my side. It's been coded.
Yeah, maybe they just really like America.
I saw a flag the other day on the back of a truck and I immediately had a negative response. And then I saw that it said F ICE on it. But the way you're communicating that is coded.
Yeah. But it's so interesting that you use the word coded. I never thought of it like it's such a buzzword, but it's true. We're coded to look at what's safe, what's not safe, because we're in this heightened climate of keep us safe, keep us safe. It's even in the language. We've got to break out somewhere or else we're going to be so permanently divided from everyone and everything, which, by the way, fight or flight is also high inflammatory. It's high disease. One of the studies at the One Research Foundation that we did was on chronic low back pain. But the piece that we want to extract for this conversation is that in a matter of 2 treatments a week of NET over the period of 4 weeks, they lowered 3 different types of interleukins, which are basically our high inflammatory blood markers, as well as C-reactive protein, which is a heart inflammatory predictor of heart attacks, et cetera. And they changed all of that in 1 month. So when we talk about fight or flight, this is not abstract and only walking around with our shoulders up to our earlobes. It literally is diseases. If we're talking about health in this country, it's heart disease, diabetes, because we get elevated glucose changes with that, immune dysfunction because our immune system goes up and then we can't sustain it for that long. Why are people so sick?
Stress does not enable the body to get well. And if you're carrying it around all the time, you're going to be sick all the time. And Laura and I talked offline about the phenomenon where women in bad relationships and bad marriages will die younger because they're under this constant stress and their bodies start to
wear down. When you're inflamed all the time, you're not going to live a really long time.
No, your heart's inflamed, your digestion, your blood pressure, your blood vessels, all of it.
Looking back at our dad, he was one of the most stressed out people I've ever met. And it had an impact, it turns out.
Burger pizza, burger pizza.
Burger pizza, burger pizza. Sometimes cigarette. Let's throw a few cigarettes in the mix. See what happens.
Laura, what are your final thoughts about NET?
I think NET is really great, but I kind of thought that going in. It has been really interesting to hear Dr. Carrick's insights. When people ask me to explain NET, I have a really hard time, which is why I made the handout. What I want to say is we're talking to your body, which everyone tells me not to say. Then I say, let's do witchcraft, which other people also tell me not to say. Preparing for this, watching the documentary Stressed, which you can find on YouTube, it gave me a lot of insight into how all of this works. It's one of those things where somebody says, well, why are you doing this or that? Well, because it works. Well, why? I don't know. It just works and I like it. And I feel like everyone should at least try NET because sitting here and talking about it is not the same as experiencing it. And once you have experienced it, it's very difficult to say that you didn't love it. Personally, it's been an incredible experience. I have grown so much emotionally, spiritually. I used to call it scream crying because I would go into the office and just cry until I was throwing up, basically, and then walk away feeling a whole lot better. I would encourage anyone who's listening, if you are a practitioner, look into getting certified in NET. It's been a real game changer for my practice. And if you're just a person who likes our podcast, you may want to look around and see if there's an NET provider that you can utilize. Dr. Carrick, what are your final thoughts on this topic?
Thanks for having me on. It's so fun to talk about NET because it's so rich. And really, from my own personal quest, it is about really caring truly for the whole person, mind and body, and honoring that those are so deeply interconnected. And I would echo, NET is something to be experienced. And it is in some ways hard to explain, which I think is why many of us have referrals from people who have experienced it. They go, well, you just got to go. You just got to go. And we have literature. There's brochures. There's the oneresearchfoundation.org. There's netmindbody.com. They have a practitioner finder on there. But really, it's going into experience it. You can see it on Grey's Anatomy. NET was actually featured on a Grey's Anatomy episode when Owen went to therapy. His therapist was very progressive, used NET, supervised by an NET practitioner. So it is an excellent representation of that. You can watch the documentary Stressed. One Foundation has all sorts of docu-series, little bites that are 7, 8, 9 minutes long. Give yourself 3 to 5 visits. So it's trying it. It's like you don't try something once and go, this isn't for me, maybe unless it's like liver.
Not
Try
liver
it.
in your body, but liver and onions.
Yes, liver and onions. Gag. But try it because the changes that we get in the brain, they did functional MRIs of the brain, and NET literally changes the structure and the function of the brain in 3 to 5 visits. And that's through fMRIs, which are one of the gold standards of brain imaging. Looking at it going, okay, it might seem witchy. It might seem like it's out there, but really it's leveraging one of the best things we have, which is human physiology, and knowing that you have within you the answer, you have the solution. And as we like to say at the One Foundation, the tagline for that is imagine a better you, imagine a better world. And you don't have to scream cry. The other day, oh my gosh, this woman, she just laughed and she was hitting her leg and laughing and scream laughing. That was her particular version of release versus somebody who might yawn, somebody who might cry. You don't have to be like, I'm not crying. You could be.
You don't have to scream cry, but it helps.
You could be in for a laugh, Just do it because everyone deserves a shot to have the hope of living more and more free from their little T traumas or big T traumas.
So, Virginia, what are your final thoughts on this topic?
First of all, I want to thank Dr. Misty for coming on. We have had some FPs, some famous people on this podcast.
Humble brag.
We recently had Maria Bamford, who's an amazing comedian and amazing voice in mental health. Laura was so excited to have you on, and she was so excited about the great work that you've done with her and the influence you've had on her, and spoke so highly of you. I'm very grateful that you were able to take the time today and that we were able to introduce you to our audience. So thank you.
Thank you. So fun.
My final thoughts are, it's interesting to continue to dive into the mind-body connection and have this specialized topic touch so many topics that we've talked about before, because we just keep talking about how your brain is not a separate entity. Your brain is not the boss, but your brain is making your life bad. So you should try to fix it.
Dr. Carrick, if anyone wants to do NET with you or learn more about all of your training and everything that you're doing, how would they find out more about you?
As a friend of mine said, I'm unfortunately like a phantasm. There's not much out there. I am in the stress documentary, and I am the person, even if you don't see me, that's doing the interviews on the docuseries for the One Foundation. I'm on there. My practice is Carrick Health and Chiropractic in Baltimore, Maryland. But I wouldn't go to my website if I were you, because it doesn't really tell you much.
I found some stuff.
You did find some stuff. Working on that, which is hilarious.
Look for improvements.
Yeah, exactly. Under construction.
Tell the website again.
Carrick Health and Chiropractic.
On carrickhealthandchiropractic.com.
And also, if anyone wants to learn about becoming an NET practitioner, they would do that at netmindbody.com.
Yes. If you're looking to explore this yourself, a strong resource would be firstaidstresstool.com. So firstaidstresstool.com. And that is a website that has the very simple instructions to the home care for NET, where you use the pulse points so you can do that on your own without a practitioner. It's not the same thing as NET. There's actually a video that goes with it to show you how it works. This was used in some of the studies, and especially the more recent study on pelvic pain, which we know is one of the most devastating conditions, one of the hardest to work with. Those patients in that study use the First Aid Stress Tool twice a day, every day, as part of their treatment.
Sometimes we call it the FAST technique.
Correct.
Virginia, if people want to overcome their trauma by going to a comedy show, how could they find out more about you?
You can find me and my calendar, everything that I'm doing and everything that I'm thinking about, and every place that I am on the internet at my website, which is www.badinia.com, BADINIA.com. That's also what I use on Instagram. You can find out more about My Sister's a Therapist from our Instagram, from our website, and just from asking people on the street. Laura, where can people find you on the internet should they wish to do so?
They can find me at my professional website, lauraryan.org, or they can find my extremely unprofessional TikTok account, I am Laura Ryan. They want to find out about this show, basically, and my AI creations. If they want to find all the episodes in one place, they can find us on YouTube. They can find us at mysistersatherapist.com, or they can find us on our Instagram account, My Sister's a Therapist.
If you enjoyed the show, we would love to ask you to subscribe, follow, hit a plus somewhere, put a thumbs up on it. We would also love your reviews. If you write us a review, we will read it on the air and make you famous for a week. And you can do that on YouTube now. You can do it on Audible. You can do it on Spotify, Apple, pretty much everywhere you listen to podcasts. If you would like to write us about a topic or an idea or just a comment, you can write us at hello at mysistersatherapist.com. If you would like to give us money to promote a product, and we're very serious about this. There's a lot of products that we have on the list that we would love to promote. You can write us at hireus at mysistersatherapist.com. We are especially on the lookout for liquid death, but not the fruity kinds, just the water kind. Aura health tracker rings, G-Sauce, the inheritor of the crown of bitchin' sauce. We would love to sell Aveda products. Laura's always very into that. Costco and Imperfect Foods. Reach out at hireus at mysistersatherapist.com. Laura, do you have something to share this week?
I certainly do. This is a review from Audible from DC Podcaster, and the title is Raw, Real, and Very Funny. Laura and Virginia have very eclectic tastes in so many areas, and I love how well-read and intelligent both of these women are. I've learned about Greek mythology, the pointlessness of boyfriends, and many psychological conditions that I'm probably developing as I write this. These two give each other grief in a way that only sisters can, but there's always warmth behind it. Way to go. Keep it coming. Thank you, DC Podcaster.
Thank you so much. That's adorable. It brings a little tear to the eye. Again, we want to thank Dr. Carrick for being on this week. We want to thank you, our listener. And we want to end on a meditation from our spiritual founder from Trading Places, Billy Ray Valentine, Capricorn, as he said, "We can make it, baby."
Me and you.
Bye-bye.